Okay, well, I want to talk a little bit about insurance coverage, and I want to talk about evidence, choice of different kinds of treatments, which is best, how we decide those things, and some recent, very exciting research about the Mini Gastric Bypass, but also about the Roux-en-Y and the lapBand. So, first of all, you have insurance companies, and some of us kind of say negative things about the insurance companies. Oh, they're bad guys, and a lot of times the insurance companies are trying to do the best they can. They're not bad people, but they're trying to save money and not spend too much, and they want to choose the most effective surgery that's the least cost. And hopefully they won't cut one corner to get the other, but they ideally would like the best treatment for the patient. And the question comes up, you might go see somebody if you had heart disease, and you might have a doctor say, you need heart surgery bypass. And you might go to the doctor who is in the next office and have the doctor say, no, you need a catheterization and angioplasty. And you could go to the next office and the heart doctor said, no, you need medicines. And you go to the next office and there was a herbalist who also has a yoga studio in the back, and he might say, just you have to breathe the fumes to get better. And then you might turn in a request to Oxford Insurance and say, hey, I want to breathe fumes from the herbalist. I want to have the colon cleansing that he offers. Or I want to have the heart doctor give me medicine, or I want to have the angioplasty, or I want to have heart surgery. Now, what should the insurance company do? Because they're getting that call every day. The herbalist is saying, yes, coffee enemas. Right? And the heart doctors say, no, you guys, there are all these surgeons and catheter, just take a pill. Just take a pill. He takes some lovastatin or Lipitor and eat a low-fat diet and go exercise. And the other cardiologist says, no, they'll never do that. They have to have an angioplasty. And the heart surgeon says, I'll fix you. So our society, doctors in general, and insurance companies have tried to come to a method of determining what's right. One method is they get people's opinion. And if everybody agrees on something, that's probably right. On the other hand, we know that's not always true, because a lot of us as surgeons used to believe that you don't have to wash your hands. Joseph Lister came and talked in front of the American Surgical Association, and he said by using antisepsis, he had cut the death rate of open fractures from 90% to 10% in his ward in Glasgow. And the surgeon said, wrong. Surgeon said, and the general agreement was that if you had a breast cancer, you had to cut off the entire breast. And we all agreed that was the right thing to do. It's called a radical mastectomy or a modified radical mastectomy. And we all agreed that was the right thing to do. And a surgeon from Italy named Dr. Bonadano did a study, and he said, no, just take out a little lump. And we went to big meetings, and we used to yell at each other going, no, you have to cut off the whole breast. And that opinion that all of us as doctors and surgeons shared turns out is wrong. So one of the ways insurance companies and doctors decide is we let the experts decide. But occasionally there's disagreements. And so they've tried to say, how can we mediate if they have bright, intelligent, good doctors disagree? And one of the best things they've come up with now, which a lot of people agree on, is what's called scientific evidence. In other words, can we look in the published medical literature and pick out the answer to these questions? If we do a study of thousands of women, some of whom have modified radical mastectomies, and some have a tiny lump taken out, and the people with a tiny lump do as well or better, then maybe the wisdom of everybody's opinion is incorrect. So what they've done is they've looked at scientific literature and they've classed it as different power, different levels. Level 1 type of scientific information has the most power, and it's something you've probably heard of called a controlled prospective randomized trial. Half the people get something, half the other people get something else. They're all the same. At the end of that study, we compare them, and that's called level 1 evidence. Level 2 evidence is a study of a whole bunch of people followed and tries to compare it. And level 3 is just reports. People say, oh, I saw this and I did this. But the most powerful is level 1 evidence. Now, we've been doing the MGB now for over 13 years, and we've had 40-some articles published from around the world. Essentially all say good things about the MGB except for 2. So the Mini Gastric Bypass with level 2 and 3 type evidence has always been published and always shown to be good. And thousands of people have had it and the results are good. But as of this past summer in Paris, 3 level 1 studies have now been reported. Level 1 studies are in Taiwan. Dr. Lee had people come into his office and he flipped a coin. In heads, you got a mini gastric bypass. Tails, you got a Roux-en-Y gastric bypass. MGB, Roux-en-Y. They did a controlled prospective randomized trial. Over 5 years of follow-up, the MGB was as good as or better than the Roux-en-Y. In another randomized controlled prospective trial, the MGB was better than the lapBand. And finally, there's a new study and a new treatment called the Sleeve Gastrectomy. The Sleeve Gastrectomy is a lot of people like, and in this study they did something really interesting. Half the people got a sleeve gastrectomy, had diabetes. The other half had a sleeve gastrectomy MGB who had diabetes. At 2 years, they compared the results. Half of the sleeve patients had cured their diabetes. Almost all of the MGB patients had cured their diabetes. That study, controlled prospective randomized trial, level 1 evidence, showed that roughly the MGB was twice as good as the sleeve. So now we have 4 studies, including an old one that was done. I think it's your wife. 740? He's being a bad boy. No. I'll call her later. So now we have those 3 studies plus another study, all level 1 evidence that show the MGB is better. This is a big deal to take to your insurance company. Just this morning, I sent out a copy of a draft letter with this kind of information to the big mailing list, our mailing list. So take a look at that. And I would love to be part of the appeal process now because we think insurance companies, peer doctors are going to begin to start saying yes when in the past they've said no to covering the MGB. And the reason, and this is something all of you want to use when you speak to your insurance representative, there is now level 1 evidence, controlled prospective randomized trials, that the MGB is as good as or better than every other weight loss surgery. So that's something when you're on the phone, when you write your emails, and what's in our letters, you want to say over and over again. There is now level 1 evidence, controlled prospective randomized trials, that the MGB is as good as or better than every other weight loss surgery. So I'd be happy to be part of that review. I'd be happy to come to New York for business and be part of anything I can do to help. And now we have strong information. Now, those presentations in Paris where Dr. Lee talked about it are now going to appear in what we call the magazines, the journals. And so they haven't come out yet, but they should be out in the next couple of months. And then we'll be able to refer to them, and that's going to increase our power and our ability to convince insurance companies that they should cover the MGB.
Do they ever cover retroactive?
Yes. You get in there and start fighting. Yep. And now, if you had said do this a year ago, I'd say chances are close to zero. Now, this big deal, insurance companies, scientists, the other doctor, see, one of the things in the review is they're going to call in another doctor, Dr. Joe Smith. He might be a surgeon, he might not, but he can read the literature and things like that. And now what we have is what all doctors kind of go by, level 1 evidence. Plus we've got the other stuff, my experience, thousands of cases, lots of doctors around the world saying that it's not just me saying it's good. And so we're on the threshold. If we don't win for him, by next year around this time, we're going to start seeing the insurance companies give in, because this is the way they work, which is controlled prospective trials, level 1 evidence. Okay, we agree. Now what the anti-MGB people will say is, oh, that's not a very good study. But that's okay. But the thing is, it's the best evidence out there. It shows incontrovertibly MGB is better than the other types of surgery. Now, it's still absolutely not completely done deal, but it's going to mean insurance companies and doctors are going to change their tune, because this is a real big step forward, because we now have level 1 evidence. Yay! So yeah, anything I can do.